So, hello everyone. I'm thrilled to welcome you all to our session titled Scientific Communication in Research and Medicine with Dr. Vincent Racaniello. Dr. Racaniello is a professor of microbiology and immunology in the College of Physicians and Surgeons of Columbia University. In addition to conducting laboratory research on viruses since 1975, he founded a podcast, Microbe TV, and hosts a virology blog to educate individuals about viruses and viral diseases online. So attendees, just a reminder to feel free to put any questions that you have throughout the presentation in the Q&A section. And let's welcome Dr. Racaniello.
Thank you so much. It's a pleasure to be here. So I'm going to talk to you about communicating science and give you our experience, why you need to do it, and how you could contribute as well. So I'm all about scientists communicating science. And it's quite clear that scientists have a responsibility to engage in discussions about how their work may be used in society. And there's a division of the National Academy of Sciences called the Public Interfaces of the Life Sciences that provides scientists with tools to do this. And you can go to this site and get more information. Now, why should you communicate science? Well, there are many reasons. During the previous administration, we had a president who waged a war on science, was anti-science. And so this was an editorial early on in that administration, which is unfortunate because, as you know, science and politics should never mix, but politicians always take the opportunity to manipulate public health to their benefit. And that is very sad because, as you know, it's our job to take care of people, to make sure they're healthy, not to use public health for political purposes. Here's another reason. This was an op-ed published in June of 2019, and it's so prescient. When the next pandemic strikes, we'll be fighting it on two fronts. The disease, okay, researching a cure, inoculating. The second is new, fighting the deluge of rumors, misinformation, and flat out lies that will appear on the internet. And of course, this is so true. There's misinformation, there's rumors and flat out lies, and most people don't know how to deal with them. And that's one reason we, as scientists, communicate science. I want to show you a few polls from Research America that they conducted. These are a number of years old now. They conducted these with non-scientists in the public. How trustworthy do you consider each of the following to be as spokespersons? And scientists win over everyone else, including healthcare professionals, journalists, bloggers, et cetera. Elected officials are, as they should be, at the bottom because they shouldn't be talking about science. How about, is it important for scientists to inform elected officials about their research? Very important, 51%. Of course, they don't listen. However, do scientists effectively communicate? There's a bit of a split here. Yes, no, and not sure. So we have to do a better job. And I can absolutely see why this is questioned. Should elected officials listen to advice from scientists? Well, here, unfortunately, the public, 38% think it's very important, but 42% think it's only somewhat important. I think that's wrong. And that's, again, where communication could help to improve that, because elected officials need to listen to scientists because they are not scientists themselves. And even if they're MDs, that's not being a scientist, as you know. Here's one I threw in because it is driving our pandemic, the unvaccinated population in the US. And this is 2015. How confident are you in our current system in the US for evaluating the safety of vaccines and recommendation? And look at this. In 2008, 53% were somewhat confident, 32% very, and it kept going down and down. And now we're in a condition where half of the US is fully vaccinated against COVID, and it's getting very, very difficult to do the rest. Should science be partisan? Is it the business of one political party or another? And they agree. The public agrees that science should not be partisan. Yet you find states where the governors say you can't have a mask mandate, which is a political statement, not a scientific one, because we know that masks work. So how can you say you can't have a mask mandate? Should we get rid of seatbelts too? Anything that you don't have a choice with? It's absurd. Finally, my most favorite, Name a living scientist. Most Americans cannot, 70%. Here's our problem, folks. If you want to be a scientist, you need to communicate. You can't just focus on your science. And the ones who could, at the time this was taken, Stephen Hawking was alive. So that's good. But then many of these other people are science communicators. They're not doing science. Jane Goodall is a scientist for sure. But everybody else is a science communicator. And Mehmet Oz is a fraud who doesn't know any science, unfortunately. All right. So those are some of the reasons why we communicate. One of the first rules is to know your audience. I think there are three general audience out there. There are people who don't know any science and don't care. They're not interested. They can barely get a job and pay for their family. And I understand that. There are people who are science literate. They seek out science, and that's mainly who we get, although it's changed during the pandemic. And then, of course, there are scientists who are interested in science. Before the internet, you could communicate science in three ways: by writing, by teaching, or by engagement, which means you give a talk. You go to a restaurant and you could give a talk, or a cafe. But of course, post-internet, we have the world at our fingers with the internet and apps and social media. So there's no limit to what you can do. I am a scientist. I am a person who has a PhD. I was trained to do research. I have been doing research for over 40 years on viruses. I write grants. I train students and postdocs. I write grants to support the laboratory. I publish papers. Traditional research scientist. A number of years ago, I found that communicating science was very important. So I'm going to tell you today how I've got interested in blogging, podcasting, videos, and social media. The driver for all this is the publication of a textbook, Principles of Virology, was the first edition here, 2000. And then subsequently many editions, and the last one was just published in 2020. And because of doing this, I learned a lot of virology. This book is a different approach to teaching virology. It does it by process, not by virus. Teaching virology by virus is not teaching basic virology. It is giving a list of viruses, and you don't learn any principles. So we wrote the book differently. So in the end, we all had to have a lot of knowledge about different viruses. So with that, after the publication of that first book in 2006, I started blogging. I called my site Virology Blog. It's at virology.ws. And every week since then, I write a post. And I also have two other authors helping me write: David Tuller, who is a science journalist at Berkeley, and Gertrude Ray, who is actually a patent officer with a training in virology. Who reads my blog? Everybody. These are countries in the world that read the blog, and 85% of them are new visitors. There are a few countries that don't read it, countries in Africa. Greenland apparently doesn't like to read it. Well, I'm sorry, Greenland, but most countries do. And here's just a breakdown of the numbers. We have over 1,600 posts and 18 million page views since the inception, about 270,000 page views a month. And here are the top countries. And you can see there are some interesting countries here that have engaged in this blog. So blogging is not dead. If anyone tells you that, they're wrong. You can still reach a lot of people if you like to write. It's a great way to hone your writing. And I make myself write once a week. I don't make myself. I make sure I do, because I love the writing. Podcasts is the next thing I got interested in. What is a podcast? You all should know, but in case you don't, it's episodic digital audio distributed on the internet. Episodic is the key. That means you have to do it on some regularity, whether it's daily, weekly, or monthly. If you do it once every 6 months, it's not a podcast, and you'll never grow an audience. The technology behind podcasting, of course, the internet, digitization of audio files, syndication by RSS feeds was developed from the 90s to the early 2000s, and portable digital audio players were a major factor in the growth of this. In fact, the iPod was the first big one, and that's where the name came from. And in June 2005, Apple released iTunes version 4.9 with native support for podcasts, and that's what drove the explosion of this field. Now, there's no more iTunes anymore per se. So there used to be an iTunes podcast directory. You can still use iTunes or Apple as a directory for your podcast. But here, for example, was the podcast directory a number of years ago before it changed. And they had podcast categories. And one of the categories was life sciences. And our podcasts regularly appear in this category: TWIM, This Week in Microbiology, This Week in Parasitism. So it's a good way to get exposure. Of course, now podcasts can be heard on Spotify, Google Play, Pandora, etc. And everyone's getting into podcasts because advertisers have discovered them. And there are many big names in podcasts, like as you saw in this previous slide. Look, NPR, I mean, Gimlet Media, these are all big companies, National Geographic, and we're just a little bunch of academics. So I thought it would be neat to start a podcast where we have scientists just talking. We have great conversations in the lab, but nobody hears them. So let's capture these discussions. So I started it in 2008, This Week in Virology. And these drawings were made by one of our listeners in Australia and others. And now we have myself, Dixon Despommier, Alan Dove, Rich Condit, Kathy Spindler, and Brianne Barker, all people working in the field, and we just chat. And this has grown enormously. In fact, when we go at meetings, when we used to go to meetings, here's a virology meeting, and that's us up front doing a live TWIV. Look, the room is packed. It's standing room only. And this is very exciting for us. And we have conversations about viruses. We talk about viruses in the news. We have our listeners send in email. We have guests. We do live episodes. And of course, since the pandemic, our audience has exploded tenfold or more. And many, many people are listening who didn't even know what a virus was. Every episode, we're now up to 790, has its show notes, which summarizes the episode, has links to the audio. We now do video as well. And on the bottom are links to the stories that we talk about. I want to give you an idea about the penetrance of podcasting. Now, before COVID, we published 577 episodes, about 6 million total downloads. And every week on Sunday, I release an episode. It gets initially about 3,000 downloads. You can see pretty steady there. And then some of the highest downloaded episodes get 10, 11,000 downloads. And the most popular one before COVID was one on bioweapons, one on CRISPR, et cetera. Now, here's the story after COVID. We're now at 790. We have 16 million downloads. So that is 10 million more than we had for the previous 10, 11 years. And in 1 year, we added 10 million downloads. And now when we release on a Sunday, we get 30,000 downloads right away. Here's our top episode of all time, TWIV 640, Test Often, Fast Turnaround with Michael Minna, 72,000 downloads. We had a episode with Tony Fauci, but it's not in the top 10 here. But you can see the numbers are great. I wish this were higher. This should be hundreds of thousands. But part of the difficulty is that I'm doing it myself. Early in the pandemic, my colleague Daniel Griffin, who is chief of infectious diseases at Northwell, he started doing clinical reports, COVID clinical reports with me. He's my co-host on This Week in Parasitism. We now do this every week. It's a 30, 40-minute clinical report. This is number 74. And he started doing them from the hospital parking lot. He would leave the hospital, go into his car, take off his mask, and record. And many, many people find this extremely useful. Who's listening? All kinds of people, from high school through healthcare, graduate students, professors of all kinds, even people who don't have a professional degree, sanitation engineers, painters, laborers, policemen. Once we had a letter from a policewoman, and she said, my only PPE is latex gloves and a Glock. We get great email from listeners. Here are just a couple of them. I'm beginning to understand how scientists think and how they work together, asking questions and solving problems. That's exactly what we want to teach people. I listen to your podcast every night. I find it inspirational in these dark times to listen to the erudite seek scientific truth when the world is drowning in folly and lies. And this person said we're their best source on COVID, which many people tell us. So this podcast empire, if you will, has now expanded into 6 podcasts. This week in parasitism, microbiology, evolution, neuroscience, and immune. 70% of our listeners are not scientists. On each show, I have different co-hosts who are experts in the field. And while TWIV is the biggest in terms of audience, the others have substantial audiences of very devoted people. Now, one of the issues with our podcasts is that they're typically 1 to 2 hours. We try and make them understandable, but we could do better. And so I'll tell you how I'm working on that. How do you make a good podcast? This is us in the early days before it really expanded. Have a conversation, I think, is the best way. I think teaching via a conversation is the best. You don't need to show slides. I think at a meeting, when people get up front and sit around and talk, that's the best way to learn. You have to have great audio. You have to follow a schedule. You have to engage your audience. We ask for questions and they're sent in. We answer them on the show and people feel like they're part of the show. There are different ways that you could augment that now. You could actually bring people in live if you wanted to. But you have to bring them into the show and not see them as something separate. Okay, so that's podcasting. The other thing I do is I teach virology at Columbia. I started teaching in 2010. I go down to the undergraduate campus, and there was no virology course there. These students are paying tens of thousands of dollars in tuition, no virology. So I said, this is ridiculous. So I started in 2010, and as you can see, the enrollment has steadily increased. Now we have 130, 150 students every semester. I just finished teaching a summer version. I put these videos online, and back in 2010, that was novel. When Apple released iTunes University for the iPad, they featured my course on their app for the first week or so. And this got us a lot of subscribers. They used to run iTunes University, and I put my videos there. And you can see the first year I put them up, 88,000 people subscribed. It went down because then we put our course on Coursera, this massively online open courseware site. And I did this only twice, but we had 54,000 and 35,000 people register for the first 2 installments. We split the course into 2 pieces. And now I put all the lectures online every year. This is not in date. I have many, many more lectures and hours, including the most recent is 2021. So then our YouTube presence expanded. As a consequence, I have a channel on YouTube where I post not just the virology lectures, which are down here. By the way, the first virology lecture for the 2020 course, because of the pandemic, got 600,000 views. And I think that's amazing. I continue to release them every year, and many people watch them. They're free. We also release our podcast now because we do video, This Week in Virology, This Week in Evolution, etc. And I've also discovered live streaming on YouTube, where once a week I go on with my colleague, Amy Rosenfeld. We do a live stream where we answer people's questions every Wednesday, 8 p.m. Eastern. And this past Wednesday, we had 750 people there asking all sorts of questions. And live streaming is is really a good way to reach people because they come to ask questions. You can interact with them. It's recorded, and so people can go back and look at it. And it is a live way to reach people. And I'm going to teach a virology course in the fall, live streamed on YouTube as an experiment, because if it works, then I'm going to teach a lot of courses online. I think it's a great way to reach a lot of people. I also use social media. I have a presence on Twitter. I've been on Twitter a very long time. Just after it was established, I recognized it would be valuable. I don't spend a lot of time engaging, but if you would like to do some in communicating, it's a good thing to do. I have too many podcasts to run, but we have a good amount of followers. And the really exciting news is that we have now opened a recording studio here in New York City, right near Penn Station. We call it the Incubator. It's kind of a takeoff on Andy Warhol, who called his art studio the Factory. We're going to make science content. We're going to make videos and podcasts. We're going to do interviews. And this is actually the studio part, which was just refinished. And I'm going to be putting interview stations in here. I'll be doing all my podcasting, live streaming videos, et cetera here. And I've made a company called Microbe TV Incorporated, and I filed to be a nonprofit so we can get donations to support us. And my colleague Daniel Griffin has a nonprofit called Parasites Without Borders, and he's also a nonprofit, and he and I are co-leasing this space. Very exciting. Next phase in my career. So just to round out the end here, what can you do? Well, blogging is cheap. It's just a matter of time. And if you like writing, I would say start a blog. You have something to say. People always say to me, well, you've got the virology space. No, you have something different to say for sure. You just need to find it. It may take some work. You'll find it if you like writing. Podcasting is a bit different. You need some equipment and you need to do it right. You can't just pick up your phone and record a podcast. The audio won't be good enough. And when you do a podcast, that's all people have is audio. You can do social media. I've done science cafes at restaurants and so forth. That really works. I also teach at local high schools. I go in for a day and talk to classes. So there are a lot of things that you can do. And, if you can't think of something to do what Mary Woolley says. She's the CEO of Research America. She says, if you're in an elevator or somewhere and someone asks you what you do, you tell them, I work for you, because you do. If you're a scientist, you're doing science with taxpayer money. So you're working for them, and they're going to say, what? How is that so? And that gets you in. You can talk to them. Because if you say, I work on fruit flies, they're going to go, okay, and leave. So you tell them I work for you and then segue into it. Just communicate in some way. We all have to communicate in some way. In fact, that's what I do all the time now. I view it as the second phase of my career, communicating science. And once the studio is up and running, I'm going to be going there every day and making more and more content of different sorts. I'm going to experiment with short form. For example, something happens one day, I can make a 10-minute video and put it out right away and explain what's going on. And we have a need for that. I don't want to depend on the mainstream news to give people their science, because they mess it up. I mean, just the current pandemic alone, they mess it up all the time. This idea, for example, let me just give you one example. The vaccines are not preventing infection. Oh my God, we're all doomed. Really? Do you know any human vaccine that prevents infection? Well, there's only one. There's human papillomavirus vaccine. The others allow infection, but they prevent disease. If you knew some virology, you'd know that, but the journalists don't. And it's the fault of the scientists that they don't. So we need to reach out in different ways. I do a lot, but you don't have to do so much. You need to do something though. And I suggest you follow me to see what I do so you can learn. That's how I did it initially. I didn't follow scientists because they weren't communicating, but I followed other people who were communicating. I learned from them. I'm on Twitter, YouTube, Facebook. We have a great Facebook presence, many, many thousands of followers. I also find Instagram really good. That's a way you can communicate. A lot of good science communicators on Instagram. If you like taking pictures, especially if you're in a lab, people love to see lab pictures and explain what you're doing. And there is my blog. Microbe.tv is where you can find all the podcasts, or wherever fine podcasts are aggregated. Okay, I am happy to take questions at any time. Thanks for listening.
Thank you so much, Dr. Racaniello, for joining us and for giving that wonderful presentation. I personally enjoyed it as a researcher, learning from you. And we have several questions in the Q&A chat from our audience members. And so we have time at 10 minutes after 1 p.m. if you're still available to answer more questions. Sure. So just to give you a heads up, and to our audience members, we will be happy to take the next 20 minutes to do this Q&A. So Dr. Racaniello, I'll get started with the first question. This is from Joshua. What do you do to keep the science communication process interesting and enjoyable over so many years?
Well, science is enjoyable and interesting, right? It's an easy thing in my view. So there's plenty of content. I mean, just in virology, and I should say, our frequency of TWIV has gone from once to 3 times a week. I never have a problem finding content. But the other part of it, of course, is presenting it. And there are 2 ways you can do that. We have conversations that we record and release, right? And I pick people who are good chatters. Not everyone's a good chatter. Not everyone likes to talk. Some people, you ask them a question, they say yes, and that's it. And that's not what I need, right? I need someone who's going to go on and on and on. And maybe you have to say, that's enough, but that's what you need. And I think for all the pods, I've actually got the right people who like to talk and are knowledgeable. And there's nothing better than to get on and say, okay, there's this paper, this finding. What do we think it means? What's wrong with it? What does it mean for the general population? And people love to hear that conversation. So in the end, you need to be curious and passionate. And if you are, that will drive long-term interests in your work. And that's what I've always been, curious and passionate. I learned that early on. That's what you need to be. And that's, if I gave you one bit of advice in your careers, be curious and passionate. Be curious about everything and be passionate and work hard on it, and people will be interested.
Thank you so much for that word of advice. Our next question is from Kirtana. How do you think podcasts and blogging have affected people's perspectives on vaccines? Have you seen anyone personally who changed their mind after watching or reading?
Oh, yes. We get a lot of emails from our listeners. I get so many every day that I can't answer them. I have trouble getting through them. I really need to get someone at one point to help me. And that's the point of, making a nonprofit and raising money. I want to be able to help people, because so far I've done all the work myself. Many people have written and said, I used your show and what you say to convince my friends to get vaccinated, right?
Yeah.
And people ask us, how can I tell my friend who is anti-vax? And we give them advice, very specific advice. And many people tell us it helps. Now, of course, it's a fraction of everyone that's out there. But a lot of people tell us, I have friends who don't listen, but every week I give them a summary of what you say. And so you're really influencing way beyond your downloads. So I think we've been doing this for 12 years. It's not something that popped up in the pandemic, right? And so we have a reputation, and there are a lot of pods that popped up suddenly and people want to make money on the pandemic. And I would say our advice is really good and people recognize that. So longevity in a field, it really helps, I think. So the answer is yes.
Thank you. I'd like to actually expand on that question personally. What is the advice you give to your viewers who have family members or friends who are against vaccines or against specifically the COVID-19 vaccine?
Well, there are 2 levels of advice, right? There's some people who think, and this is because they go on Facebook and they get the wrong information, right? I mean, unfortunately, there's a whole bunch of people out there that spew misinformation about vaccines. There are about 12 people that spew most of the vaccine misinformation. And the reason they do is because they get paid to do it, which is so sad that someone would pay to do that and cost people their lives. So we dispel those things, like the vaccines will make you sterile. The vaccines have a microchip in them. They haven't been properly studied. They're risky. They're experimental. All that is easily dispelled. And you can tell people, here's the information. And we're scientists, and maybe it helps to hear it from a scientist. The other part is to make it personal, which is, I'm vaccinated, my whole family, my wife and kids are all vaccinated. And everyone on the pod will say, we're vaccinated. Millions of Americans are vaccinated and they're fine. And I think making it personal really helps, because a lot of people do ask us, what about you? Would you take this vaccine? And I would say, I've already got it. Yes, absolutely. And I'm here. So those are the 2 levels. There's the science and there's the personal. I think they're both really important.
Thank you. That was a really good answer. We have another question from Leslie. She asks, how can actual scientists and also non-scientists improve their communication?
Good question. By communicating. There's nothing like practice, right? So I started out, I had no communication training at all, right? But I actually liked giving talks and teaching. So I did more and more and more of that throughout my whole career. I taught a lot. And then when I came to Columbia, I taught even more, gave lots of talks. And then started podcasting, and you listen to yourself, you can tell what you're doing wrong. And I have learned, for example, to pace myself, to say something that you want to emphasize and just pause very briefly, not run on quickly, don't speak quickly. And I found listening to other people, you learn a lot about how to present, and not just the podcast, right? So spoken word is different from a video. In a video, you learn to look right into the camera and talk to people and go slowly, use great visuals and so forth. I never took a course. I just learned, and I tell people, look, I'm a scientist. I can learn anything. That's what I'm here for, to figure things out. Now, I've actually thought of taking a speaking course here in New York City. I could take one where I learned to speak even better. Certain words that I don't pronounce properly, certain cadences, and I'm thinking of doing that. So you could do that, but I think you don't have to. I think if you just emulate others and practice, practice, practice. I mean, I do this almost every day, right? I listen to myself, and that combined with listening to other people, that's all you need.
Thank you. Our next question is from Rana. Can you be a scientist if you're going to medical school or pursuing the MD or DO route?
Absolutely. No, I don't mean to say that MDs can't be scientists, but I think you have to understand that if someone is an MD, it doesn't mean they're a scientist, right? Medicine is not science. Medicine is taking care of people. You're not doing experiments on people. Science is doing experiments, but you could certainly get an MD and become a scientist. So you can do an MD PhD program, for example, where you do research. And I have had many students who do that, and they go on and have research careers. You could even just do an MD only and do research in a lab afterwards and become a scientist. So yes, there are many ways that you can do that. And having an MD gives you a different view of science, especially clinical science. It's highly valued, but the problem comes when, let's say there's a very prominent cardiologist in California who gives a lot of advice on COVID, and a cardiologist is not an infectious disease physician. And I don't know why people are listening to him. He's often wrong. So, an infectious disease physician like Daniel Griffin is who you should be listening to. That's all I say, is that MDs are not necessarily scientists, but they can be for sure.
Okay, thank you. Another few questions from Kirtana. One is just, where can we find the virology courses? Are the Coursera MOOCs free?
So the Coursera's are not up. They did a revamp of their website a few years ago, and they took them all down, and they've told me you can repost them, but I just haven't had time to do that. And it's an old version of the course, so I really would need to repost all the lectures and break them into 10-minute chunks. That's what they want, and put questions, and it's just a massive amount of work. So you can't find them on Coursera anymore. I might do it one day, but they are all on YouTube, youtube.com/PROFVRR. And you can find all the videos there of every video in my course. Every year I post a new set of videos. There are embedded in the course questions as well. And so you can get almost the same experience.
Thank you. Kirtana also asks, what do you suggest to combat the huge amount of scientific misinformation? And how should one go about interacting with someone who's been scientifically misinformed? I know we already talked about this question, but if you'd like to chat about it a little bit more about, I just think more about the COVID vaccine and how what's going on today with, I know a lot of vaccinated people who are getting COVID. Could you touch on that a little bit more about what that means for the future of the pandemic?
So when you say get COVID now, that's a little bit not quite right? Because COVID is a disease, and what these people are doing, they're turning up PCR positive, and most of them are in fact not even symptomatic. And as I said earlier, vaccines don't prevent infection. So if you are vaccinated twice, you will get infected. However, you will make very little virus. Your immune system memory will kick in 2 days or so, and then they will prevent you from getting severe disease. Now, some people do get cough and headache and so forth, and a very few people end up in the hospital. but far fewer than unvaccinated. So it doesn't matter if you get infected. In fact, I think people should not get tested because it makes them scared after they've been vaccinated. And it doesn't do any good because there's no good evidence that you're actually transmitting. I mean, you will hear out there, the CDC, oh, COVID vaccinated people still transmit. There's really not good data for that at all. And the reason is that they always use PCR. And PCR does not measure infectious virus. It just measures pieces of RNA. So if the CDC wanted to make estimations of how much a vaccinated person transmits, they should do infectivity studies, which they're not doing. And I think in the absence of those, what they're saying is very misleading. So in my view, vaccinated people do not transmit. And that's why herd immunity works, because if vaccines in general allowed transmission, we would not have such a thing as herd immunity, which means you can vaccinate, say, 80% of the population and the rest will be protected because you cut down transmission. So this is why the press is not the place to get your news from about science. Unfortunately, most people do, right? Because it's everywhere. It's on your phone, it's on TV. You can't get around. You go waiting in an airport and you get the damn CNN up there. You can't escape it. But we try to combat that because I think they propagate misinformation. They make people scared, and it's not valuable. And so that's the role of the scientist, to try and cut through that in a clear and compelling manner. That's what we try and do.
Thank you so much. I work in a hospital setting, and that's really great to hear, as I'm vaccinated, but some of my family members are vaccinated, but also I'm afraid to give them COVID. But this is so good to hear that.
Yeah, I don't think you should worry. I think that the evidence that there's substantial transmission is really not there. Yeah.
Perfect. All right, we have a few more questions from our founder, Alejandra. She asks, she understands that establishing a nonprofit takes a lot of time and effort. How do you balance creating your nonprofit and keeping up with your research and podcast?
Well, making a nonprofit just involves a few hours of filling out an IRS form, and then you wait. And then when you're a nonprofit, then you can have people donate, and their donations are tax deductible, right? Which is very good. And then you can get substantial donations from individuals, from corporations, from foundations, right, who look to support nonprofit work. I cannot go out and raise money, right? So I just hired a fundraiser whose expertise is to link up people who want to donate with recipients such as myself. And this is actually someone who found TWIV last year, and he thinks we are doing amazing work. He loves it. And when I mentioned on one live stream, I need a fundraiser, he said, I'll help you, and so I pay him, and he's going to connect me with donors. We're going to have, a little party in the studio to introduce them to what we're trying to do. And he thinks we can raise substantial money. So the key is to get other people to help you, right? So many aspects of the studio, I get other people to help me. And we're lucky that we've had a lot of contributions in the past year to help pay for this. Now, the lab, that's a good question. I could not run a lab and do all of this at the same time. So 5 years ago, I hired a former PhD student of mine to come and run the lab and basically make it her lab, do the experiments, work with people, write grants, write papers, and she does it all. It's essentially her lab now, and she can do what she wants. I'm here and we chat every day, but without her, I could not do it. I would have to give up the lab. Now, when she becomes independent, when she has her own lab one day, I'll have to shut it down and just go to my studio every day, which is fine. That'll be, I've had a long and really satisfying research career, and now part 2 is full time, and I'm very excited about that.
Thank you so much for sharing. We have another question from the audience. Clea asks, do you think that the world will face a second pandemic in the near future, or a pandemic of a more deadly form of COVID?
So we will always have pandemics of various viruses. We have had influenza pandemics regularly, right? The last one was 2009. Before that, it was 1968. We have had this is the biggest coronavirus outbreak, which is actually a pandemic. The SARS-1 of 2003 was not a pandemic, but it just showed that viruses can come from animals in nature and spill over into people and cause problems. So there will be another flu pandemic. There will be another coronavirus pandemic for sure. It might not be the magnitude of this one. This is really once in 100 years, I think. So I think future ones will be more moderate, but we're going to keep having them unless we're ready. And we could have been ready for this one. I tell people all the time, we could have been ready with antivirals and vaccines that would have stopped this at the beginning, but we didn't because there was no foresight. We get our drugs from companies, from for-profit companies. And if there's not a market, they will not make a drug or a vaccine. And so that's why we weren't ready. I'm hoping we've learned a lesson and now we can have antivirals. Well, for example, we could make a pan-coronavirus antiviral so that any new corona that came from a bat or whatever animal, we could stop in its tracks. We could do that, and it's not that hard. So I'm hoping we'll do it and be ready for the next one. We can be. Science is at the point now. Look, we made a vaccine in 9 months. That's a miracle. That's a miracle. And I think we could do other things that are equally miraculous, and it's just a matter of our will. So I'm hoping we do it. If not, then we will continue to have pandemics because we can't stop them.
It is really refreshing to hear you say creating a vaccine in 9 months is a miracle. As in a community that I've faced a lot of people say, oh, creating a vaccine in 9 months is a tragedy. It won't be as safe. I've had people say that to me, and I'm like, really, it is a miracle that we are able to prevent this disease within such a short amount of time. So thank you for sharing that.
What is sad is that
Yeah.
so many people are not taking advantage of this miracle, right? And
right.
I wish I could talk to every one of them personally and try and convince them. I know that doesn't work because I've had such conversation. It's not easy, but people really need to understand it's a miracle and it's safe. It's incredibly safe, and it prevents severe disease. It will save your life. And if you don't want to get vaccinated, and I don't care how old you are, I mean, even young kids die of COVID, or they get long COVID and never recover. It's not worth the risk, folks. It really isn't.
Thank you. We have another question. Do you think we should be retrieving data of antibody levels on those vaccinated throughout the world to see if the COVID vaccine is working on individuals?
We've already collected quite a bit of antibody data from vaccinated individuals. We can't collect from everyone, right? That's impossible. And that's why we always collect from certain numbers of people, and then we use statistical procedures to extrapolate to the entire population. So as long as we have collections from different populations, in the US, we're different from other countries. We're genetically slightly different, and we can respond differently to vaccines. And so in many countries that's been done, but I think what needs to be done is to do very careful studies to look at shedding, say, for example, after vaccination, because I think they will show that there is very little shedding and it's not a worry, as we said before, but the data don't exist, and I wish we would do that.
Thank you so much for sharing. We have one last question. Do scientists know if there's any long-term side effects to the vaccine?
Well, I think you've answered your question, right? Because we've only been a year out or so from the vaccine. But I have to say that we've never seen any long-term effects beyond 6 months after vaccination with any vaccine. And I've talked to a vaccine expert, Paul Offit, about this, and he says, if you don't see something in the first few months, you're not going to see anything in the long term. The only thing you learn, and many of these vaccines are being studied for 2 years in the initial clinical trial population. They are being studied for 2 years just to see how long immunity lasts. We need to know that, not to see if there's any long-term effects, because we already know after a few months there aren't any. I mean, there have been some myocarditis, right? There's been some blood clotting, but they're not long-term things. Those are things that are resolvable. So I don't think there's going to be any long-term effect, no, from any of these vaccines.
Thank you so much for sharing. And I know our guest speaker just shared their PowerPoint. With that, I think we will go ahead and complete the end of this session. Thank you so much for joining us, Dr. Racaniello. It was a pleasure speaking with you. I know we'll have this session recorded on our YouTube channel after the conference is over. So I personally will be sharing it with my family members, and hopefully they will change their minds to get the vaccine. So thank you so much for all of your advice and guidance.
You're welcome. Thanks for having me.
Have a great rest of your day.
Thank you.